When Robert F. Kennedy Jr. visited Samoa in June 2019, the country was facing a looming crisis. The previous year, the government had suspended measles vaccinations following the tragic deaths of 2 infants due to an improperly administered vaccine. Although the immunization program was later reinstated, public trust had been severely shaken, leaving thousands of young children vulnerable to the highly contagious disease as it resurged globally. With the vaccination coverage among infants dropping below 1/3, experts and officials grew increasingly concerned for the island nation. However, Kennedy viewed the situation as an opportunity. As the chairman of an anti-vaccine organization, he later described how Samoan officials, including the Prime Minister, were interested in assessing health outcomes after the temporary halt in vaccinations. He quickly proposed a way to facilitate such a study. This aligned with a long-standing idea he had supported: the belief that vaccine safety, despite being well documented by scientific consensus, required further study through trials that would involve groups of unvaccinated children. Accompanied by a health informatics expert, Kennedy met with Samoa's Prime Minister and Health Ministry officials to pitch an information system designed to track the effects of medical interventions, including vaccines, on the country's population. A few months after Kennedy's visit, the devastating consequences of low vaccination rates became evident. A measles outbreak spread rapidly, infecting thousands and claiming the lives of 83 people, most of them young children. As the crisis unfolded, Kennedy remained engaged with Samoa, voicing concerns about the vaccine in communications with the Prime Minister, and advising a local anti-vaccine activist who disseminated misinformation and promoted unproven alternative treatments. Kennedy's involvement in the events surrounding Samoa's measles outbreak has come under renewed scrutiny, following his nomination as the U.S. Secretary of Health and Human Services. If confirmed, he would oversee national public health policies, including vaccination programs, at a time when childhood immunization rates are declining and new health threats are emerging. His transition team declined to comment on his role in Samoa. Despite the controversy, Kennedy has repeatedly denied responsibility for the outbreak and its repercussions. In a 2021 interview, he insisted that he had no influence on the decision of parents to forego vaccinations. He also downplayed discussions about vaccines during his meeting with the Prime Minister. Furthermore, he has questioned whether measles was the direct cause of the fatalities, labeling it a controversial supposition. While Kennedy's precise impact on the crisis remains complex, and some aspects of his visit are unclear, accounts from government officials, health experts, and activists indicate that he and his organization used the initial vaccine mishap to spread anti-vaccine narratives, potentially worsening the situation. Medical professionals emphasize that when vaccination rates drop significantly, highly contagious diseases like measles inevitably return. Critics argue that Kennedy's approach of observing a natural experiment without intervention endangered children's lives, calling it an unethical and reckless gamble.